Let's go to the vaccine rollout now. There's been horrible revelations in Queensland today that two elderly patients given the vaccine in an aged care home got substantial overdoses of the vaccine. I'm joined by Ros Bates, the Queensland Shadow Health Minister today. Ros, is this the sort of accident, the sort of episode that we should expect in such a massive and quickly organised rollout, or is it simply beyond the pale?
Well, Chris, it's actually beyond the pale. I mean, it should never have happened. As a healthcare professional, you know, there are rules around giving medication. It doesn't matter whether it's a vaccine or any other drug. You know, there are 5 rights about what you need to do. It's the right dose, it's the right patient, it's the right time, it's the right route, and it's the right drug. So you need to make sure that you check all of those things. And I'm absolutely flabbergasted that a doctor who hadn't obviously been trained in the vaccine rollout didn't even bother to read the product information leaflet that would have come with the vial. And thank God for the nurse.
Indeed, the nurse spotted the problem. Now, we understand that there aren't going to be any medical disadvantages for either of these people, but they are being kept under observation regardless. And the doctor wasn't specifically trained for this vaccine rollout.
Well, I mean, that's inexcusable anyway, but as I've said before, if you are a health professional, you don't give any drug unless you know how to administer it properly. You make sure that you know what you're giving, you know what the dose is, how it's diluted, and, you know, of course, these Pfizer vials are multi-dose vials. They're not just a single ampule that you draw up, so there are instructions on how to mix it, and obviously those instructions weren't followed anyway, but for me as a nurse, I would never give a drug that I didn't know how I was going to administer it. And on top of that, you need to check and check and check. And I've always told my nursing staff, you know, if you don't know, don't bluff, because you can kill someone.
Well, we want to make sure that everybody has faith in the vaccine rollout, and there's a lot of discussion about that. That's the biggest problem really with this episode at the moment, isn't it? It's not so much the health of those 2 individuals. We understand that they're okay. The biggest problem is that the damage to public confidence in the rollout. What do you say about that, and what would be your words of reassurance to the public?
Well, I mean, obviously we need to have confidence in the rollout, and hopefully this was one outlier that won't happen. Medication errors do happen every day in any state-run hospital anyway. They shouldn't, because of, you know, the 5 rules of checking for medication, but, you know, people are, you know, they're not infallible, and that's why you have the checking mechanism. People should be confident about this rollout. We need to make sure that everybody gets vaccinated, because even if we do vaccinate 75% of the population to get herd immunity, you still need to be vaccinated yourself. So I encourage people to get the vaccine, and, you know, unfortunately this has occurred, but this sort of thing happens, you know, on a daily basis in major state hospitals anyway. It shouldn't happen, and if you're a health professional, you should make sure it doesn't. But, you know, I want to encourage people to get the vaccine, because people want to get back on with their lives. They want to be able to know, you know, when they can go to work. They want to see loved ones. I'm looking forward to this Saturday seeing my daughter that I haven't seen for 12 months, who's been locked down in Victoria. So we need to get on with our lives, and the way to do that is to get the vaccine and make sure that we're all covered and we can get back to some semblance of normality.
We sure do. Thanks for joining us, Ros.